After a very sudden and nasty divorce, I was hospitalized for suicidal ideations. That's the first time that it was brought to my attention. Wait, you're in treatment for depression, but you have a very severe eating disorder. Did I want to acknowledge it? No, who does? Because you're afraid if you acknowledge it, it's going to be taken away from you. It's a horrible, horrible feeling to have the best coping mechanism that you know taken away from you. And you want the help, but it's very, very difficult to ask for it. The turning point was when I found Dr. Susan McClanahan. She absolutely saved my life, and more important that she saved it, she gave me a life.
We're dealing with people who are suffering. They're suffering with anxiety, they're suffering with depression, they're suffering with a terrible eating disorder. And if we didn't come together as a team, there's no way we could do such profound and important work. We consult to the whole eating disorder community on how to treat co-occurring disorders. So that's something very different about Insight. We also treat obesity here.
The treatment at Insight Behavioral Health Centers is so unique and so effective because we really offer specialty care. So we're not lumping all of the patients into one group and treating a lot of different problems. We're getting them treatment that is specific to what they are coming in with and really individualizing their treatment plan. I love working at Insight because I get to work with a patient population that I really believe has been underserved in traditional eating disorder treatment.
It was pretty obvious that I had a problem. It was out of control. I didn't really know what it was at the time, but I knew I was different from all the other kids. They were out playing and I was in eating. So I thought like they're teaching now with The Biggest Loser, extreme weight loss, that it's about diet and extreme exercise. And I was wrong, and a lot of people are wrong, especially when you have an eating disorder. I didn't have the right information until I came to Insight, which is why, Insight worked for me.
We look at the patient as a whole, and we treat all of their struggles, and we help them understand that what they're doing makes sense. And that's the first piece, because it alleviates some of that shame that keeps people trapped. And we help people climb out of that hole.
I had been beaten down and traumatized by trainers and other therapists, and it never worked. But there was something special about Insight. Everything in me said, this is the place, and I have to give it all I have right now. And I did that. From day one, I made the decision to change my life.
Here at Insight, the dietitians who worked with me, it's like, you guys, you gave me this. You gave me this most amazing life, and a life that I can share with other people and that I can serve other people with.